Hello, my name is Sam Hyatt, and I will be talking about teenagers with depression and physical therapy. So just a few objectives about this presentation. I'm going to give a little overview about teen depression and how that can affect the individual. Also, I'm going to talk about the prevalence of the depression and anxiety combination. I'm going to be focusing mostly on depression and how we can address that in mental health. And then as a physical therapy student, I'm going to go into the benefits and kind of like the why of why we need to focus on this aspect of mental health. And to begin with that, I'll start with what is the teen depression that I was talking about. And so the definition of depression, I found this on the internet. It was a common or serious mental health disorder that negatively affects how you feel and the way you think and how you act. I was looking at the CDC website, and just common generalized symptoms include mood changes, withdrawal from like social events, irritability, so just having amped up emotions, and feeling tired, fatigue. This diagram I found kind of talks about the differences in men and women, or specifically boys and girls, as I'm talking about teens. You can see on this chart here that teen girls have a much higher chance of feeling sad or hopeless. And as we've been studying this for the past 10 years and more, we're seeing an increase in both of those numbers, but specifically an increase in women. And it's also worth noting, like, while all teens are reporting increases in mental health challenges, girls might be faring way more than boys, but we should still check in on the boys and always make sure that any person, depending on gender or sex or anything like that, gets the care they need and gets the resources for sure. Regarding the CDC as well, I would like to add that there's a study that was released February 2023, and they said that nearly 3 in 5, so about 57%, U.S. teen girls felt persistently sad or hopeless. And that's double to boys, representing a nearly 60% increase and the highest level reported over the past decade. So a few more statistics on teen depression. First off, there's prevalence. So Zhang was another article that I found on the NIH website, and he said that approximately 20% of all teens experience depression before reaching adulthood. And also in 2022, about 12.8% of adolescents reported experiencing at least one episode of major depression. Like I kind of talked about earlier, the gender differences kind of revolve around teen girls having way more chances of feeling depressed or sad. Another article talks about the difference in this, and they said that 1 in 5 teenage girls had at least one depressive episode compared to 7% of teen boys. So there's some ratio differences for sure there. And the growth of this difference is getting worse each year, and you kind of see that how it says it's continuing to widen, with the number of depressed teen girls growing faster than that of boys. So a little bit more. There's some treatment gaps of this too. So despite the high prevalence, only 30% of teens with depression receive treatment. And I feel like due to this problem, a lot of people are either not reporting it too because they don't feel like they need to report, or they're not getting that conservative care that they need. And this can be caused for many reasons. So treatment gap can be caused by lack of access and just the general health services, stigma, and underdiagnosis. Some key risk factors that I've found are some social challenges either at school or at home, pressures in academics or social life, so that could be friends, family, or just school in general, financial anxiety for the older teens, and if they had any traumatic events from 0 up to 18 years old. I mean, these can be even more past 18, but I'm kind of focusing on that teenage group from like middle school to high school range, for sure. And Zhang also said that teens with depression have a 30% chance of developing a drug problem later in life. I thought that was kind of interesting. And the condition significantly increases the risk of suicide, which is another avenue that we could dive down. I'm not going to in this presentation. So when it comes to the depression in teens, a few causes could just be some genetics. There could be predispositions, so kind of runs in the family, but not necessarily runs in the family, but researchers have identified several genes that may be linked to depression. And some of these include the serotonin transporter gene, which affects serotonin levels in the brain. Other factors could be environmental, so that's like external factors, family issues, school, outside stress, social media for sure is the kind of a growing one, obviously with the increase in technology everywhere. There's a few biological factors too, so you can have hormonal changes as well. I also found regarding the genetic environmental triggers, the National Institute of Health said that the genetic predisposition interacts with the environmental factors such as trauma, stress, and early life experiences. For instance, individuals with a genetic risk for depression may only develop the disorder in response to significant life stressors. So when it comes to the impact of depression on physical health, there's a lot of things that we can talk about, not just affecting the mental and emotional well-being of a patient or an individual, but also the impacts on the physical health. And so the first one could be increased risk of heart disease. And so when it comes to the cardiovascular system, if you have depression, you could experience cardiovascular deficits because of the lifestyle factors that are common in depression. So having a poor diet, lacking exercise every day or every week, and if you are depressed, smoking becomes kind of a habit sometimes, and all of these things can be risk factors for cardiovascular health. Another thing is weakened immunity, and so depression can weaken the immune system, making individuals more susceptible to infections and illness. Hormone imbalances, like I talked about earlier, can be changes in hormone levels such as cortisol, which is your stress hormone, and that can be a problem because elevated cortisol levels over time can increase weight gain, increase in hypertension, and increase of diabetes. So you can kind of see how all these physical aspects can be pretty detrimental by just having depression. It can also affect your mental and cause you to have some appetite and weight changes, so leading to eating disorders, and anorexia nervosa and bulimia are kind of like the top of that factor there. Chronic pain and how that increased sensitivity to pain can affect a person's life. So conditions such as fibromyalgia and chronic back pain, depression can lower the pain thresholds for all of these things and making physical discomfort more pronounced. Traditional treatments for depression include psychotherapy, which could be cognitive behavioral therapy or talk therapy. There's a few tools that I did find, and so there's a psychologist locator link through the American Psychological Association, and there's also a link on the Association for Behavioral and Cognitive Therapies that can help find cognitive behavioral therapists. Also, on treatment facilities, including all types of mental health, there's findtreatment.gov, which is a pretty good resource to help find those facilities in your area. Another treatment for depression is medication, which is very popular. A lot of people are on the neurotransmitters such as like SSRIs, SNRIs, TCAs, and MAOIs. So all of those are kind of going to help alleviate the symptoms of depression by affecting neurotransmitters in the brain. And I found an article by Mendez talking about the importance of treatment for depression, and they were kind of talking how you have a combination between medication sometimes, or physical activity, or a little mixture of both, with talk therapy, or just a triad of all those things. And so he's just talked about the holistic approach by combating depression. So managing your symptoms of depression involves just staying healthy in general. Being healthy is important for all children and teens, and especially with those with depression or anxiety. So having a healthy eating plan centered on fruits, veggies, whole grains, legumes can be very beneficial for the diet portion. And then participating in physical activity for at least 60 minutes each day is kind of like a staple in good health. So 60 minutes, like they did in NFL for kids a long time ago, very consistent to this day. Getting recommended amount of sleep each night based on age is also important, and if needed, practicing mindfulness or relaxation techniques. How can physical therapists help with depression is exercise, improving the sleep patterns and energy levels for the patients. So aerobic exercise can increase the symptoms, or can reduce symptoms of depression and increase that safe environment of effective workouts by not putting the patient through too much stress. Also, reducing physical symptoms related to depression. So muscle tension and chronic pain can be huge factors in causing depression in the first place. And if we can alleviate some of those symptoms, they'll reduce the amount of depression that they'll be experiencing. Some tips for teens and parents can just be encouraging physical activity and exercise, and creating a supportive environment at home and school. Having a support system, building and maintaining a strong relationship between family and friends can help people navigate those depressive scenarios and times that they feel kind of hopeless. Doing things in groups could be very fun and a change for that individual, and having regular checkups with other people can help monitor overall health. So there was an overview of the study showing effectiveness of PT in treating depression, and the NIH was looking into depression adolescents and how they're taking in their exercise. And they said that a high intensity group mixed exercise of 12 weeks, about 20 to 60 minutes at a time, and they did that about more than 3 times a week. That was a pretty good system, and that increased the patient satisfaction. And additionally, the study also showed that the antidepressant effects remained for a long time after the end of exercise interventions. So this is kind of another route where you don't have to take medicine. Exercise could be your medicine. So just to conclude this presentation, we kind of talked about the importance of addressing teen depression and how working with physical therapists to set achievable short-term goals can also provide motivation and a sense of accomplishment. And so the role of the PT could be to seek help. We can tell others that they can improve their physical and mental health, effectively manage their depression, and enhance their overall quality of life. And through a collaboration with other healthcare professionals, physical therapists can use mental health and physical health as a key to achieving and maintaining this healthy, balanced lifestyle. And here are my references. Thank you.